Good morning, everybody. I am so excited to be here with you this morning celebrating the 10th anniversary of NUHW. This is a birthday party. It's really not an anniversary. I think it's more like a birthday party because we are going to be celebrating today both the start of this important organization, but also the future that you are helping to build not only for workers, but for your patients and for our community. So I am really excited that it worked out for me to be here with you. Many of you, I have not had the chance to meet one-on-one, but some of you may have seen me on TV. So I want to talk about one of those encounters. So when I went to Washington, I had spent my career working on the issues that face working families, how hard it is to make ends meet, what happens when families get pushed by medical debt, by insufficient wages, by family breakup or divorce or domestic violence or death of a family member into bankruptcy or into foreclosure. So I had spent my career really thinking about economic inequality and financial distress. So when I went, we had the nation's largest banking CEOs come in before the committee, Goldman Sachs and Bank of America and these folks. Wells Fargo, I had questioned the previous week, and so they didn't have a CEO at that time because he had retired after we had had a conversation. But so I had the chance to ask these incredibly well-compensated, well-educated, powerful executives anything I wanted. And there were a lot of things about Congress within the institution that are also about power and also about hierarchy. And I have news for you. I'm at the bottom. I'm a freshman. I got elected with the help of so many of you in this room and folks around this country and in our community. But so one of the few things that's equal is we all get 5 minutes. Not a long time. You all know that because sometimes you're given 5 minutes to try to cure a patient. So I had 5 minutes to ask a question. And so what I asked CEO of JP Morgan Chase, Jamie Dimon, I said, I want to ask you, you consider yourself a financial expert? Yes, he said. I said, so let me ask you about a worker who'd be working full-time at your bank, JP Morgan Chase, living in Irvine, as a teller, making $16.50 an hour, which as you all are out there fighting for wages, you know is better than a lot of workers are getting in this country and in this community right now. Making $16.50 an hour, and she's a single mom to one 6-year-old girl. She lives in a 1-bedroom apartment, and here's what she spends on rent, on food, on a Cricket cell phone. She doesn't spend anything on health care. Let's give her no gifts, no vacation, no emergency fund, no anything. I went through the budget and showed that she was going to be $567 short at the end of each month. And then I asked him, an expert, a CEO, the chairman of the Business Roundtable, the nation's largest corporations, a man who's paid for his expertise $31 million a year. I asked him, how would you manage that $567 shortfall? What should she do? He stared blankly. I asked if she should take out a loan from his bank. He stared blankly. I asked if she should run up a credit card bill on her JP Morgan Chase credit card. He stared blankly. Well, most people who were watching that encounter on Twitter or on Facebook or on TV later, and the people in this room, you know the correct answer to that question. Pay your workers a better wage. And one of the most interesting things to come out of that whole exchange was the number of my colleagues and kind of the Washington establishment and reporters who said, how did you come up with that question? Well, I've tried to live on the wage that I was being paid. I've tried to make ends meet. I watch my parents and my grandparents do it. I think about how my sons and daughters are going to be able to do it. And so how did I think about this? How did I come up with this question about a teller? I look and I see the people all day long throughout my life who help me. They help me in Albertsons when I need to order a birthday cake. They help me figure out what thing I should purchase at thing. I can't even do better than that at Best Buy. What thing I should purchase. All right, they help me schedule an appointment to get seen for an annual physical. These workers are present and visible in my life, and they are present and they are our community. And the fact that too many in Washington don't even see, much less think about what the experience is like to work hard every day and come up short on being able to take care of your family is exactly what is broken in Washington, D.C., and it's exactly what I am committed to fixing. And my voice is just a part of this story. It's a voice that really is, I'm just in the position to make your voices heard. It is your work and your stories and your fight day in and day out to do right by the patients and their families who count on you, and to do right by your children and parents and family members who count on you. It is that fight that I carry with me every day to Washington. I am so proud of what this group has done to stand up and try to improve Kaiser's mental health care. I came out in December and stood with you in solidarity at the strike you had at the Kaiser facility in Irvine, and I am proud of the fine that you forced the state to put onto Kaiser for breaking the law. I am not interested in what the law says. I am interested in what the law delivers in people's real lives. And that is the fight that you have taken up, that you have made yours. Not for your sake, but for the sake of the patients, for pride in a day's work, for pride in a job well done, and for the pride in the potential to save and improve someone's life. That's what's at stake with ignoring the laws regarding mental health care in this country. That's the fight you're in, and every American should be on the right side of that fight. So I am really excited about what you guys are doing. In Washington, I've introduced a bill that would put more teeth behind the mental health parity law. It's a bipartisan bill. I found a Republican who will come together with me. I don't agree with him on anything else, but I found a Republican who will come together with me and say that the promise that this country made to Americans in the Affordable Care Act, that mental health treatment and physical health treatment will have parity, is a promise that we have failed to deliver on, and it is one that we must honor. So I am hoping to move that bill through the House. I have people, Republicans and Democrats, who are interested in moving it through the Senate, which is really nothing short of a miracle. So I am trying at the federal level to help join you in your fight to make sure that those who need and seek treatment for mental health from you get the appointments and the quality of care that they deserve. Now, we're here in Orange County today, and some of you may have heard that Orange County recently managed to get like 2 more Democrats than Republicans. This was a big years and years and decades, and we finally did it. But there are a lot of pockets of Orange County, including the area that I represent, that are still majority Republican, and some of those Republicans stand, unfortunately, with our vulgar and disgusting president. So I am going to have to fight to keep this seat, just like I have had to fight my whole life to lift up the voices of consumers and workers. And I am so glad that I will be having that fight with you. So I want to say thank you to every person in this room, whether it was in my race or in another race in this country, who came home from work and was tired and had dinner to make, had bills to pay, had kids to feed, had a mom or dad who needed help, who took time to knock on doors, to make phone calls, to walk, and to fight for our democracy. Democracy is not a spectator sport, and you all know that. And without your help, I wouldn't be able to be there in Washington. It is make no mistake, the big corporations of this country, big pharma, big banks, big fossil fuel companies, they are gonna come for me in 2020. And that means that I need people like you to have my back, but that also means that I always get to have yours. I am so grateful for your support, and I am so proud of the work that you do. We are partners, and together we will deliver opportunity and equality for every person living in this country. That's what NUHW is about, and that is what the United States is about. So together, you are fighting for our country's values. I thank you as patriots, I thank you as community members, and I thank you as workers who are committed to your patients. Thank you so much for having me here. Together, we will continue to make this country a place that we are all proud to be a part of. Thank you again.
We're very proud of you.
Oh, awesome! Awesome! That's awesome. I would put it.
You want to open this?
Awesome, thank you. Thank you. Oh, it has my name on it. Thank you. Thank you so much. Thank you.
One more hand for Katie Porter.